L1, below L1 only your roots get damaged because your spinal cord is thinning out, right? And there are only roots linked. That's right. Now, I'll teach you about spinal shock. If there is a lesion, it can either, for example, tumor, okay, or an infarction. Infarction is when there is no blood supply. So, if there is any tumor, it can grow slowly or it can grow suddenly. Okay? If it grows slowly, that is when you will see all these upper motor neuron, lower motor neuron, all these signs will come up. But if there is something like a trauma, for example, a sudden damage to your spinal cord, then what happens? First you will lose everything. You will lose your tone, you will have no reflexes, nothing. Technically speaking, if you have a damage to your spinal cord, what lesion will it cause? Will it cause lower or upper? Huh? Upper. Because it's spinal cord. Spinal cord and this brain is your upper motor. Then it's the nerves that is the lower motor neuron. So technically speaking, if there is a spinal damage, you should have upper motor neuron. Okay? Yeah. But in a spinal shock, it will cause paralysis, loss of reflex. Actually, what is the sign of upper motor neuron? Hyperreflexia, because your reflex pathway is firing. But here in spinal shock, you will have loss of reflexes. You will lose all your sensation because it's like a shock to the spine. The spine is like, oh, I'm getting like, suppose someone does something to you, it's an unexpected person, like you thought he was your friend or something, and suddenly she cheats you. You become shocked for something. You're frozen for something. So your spinal cord is getting frozen for something. It does nothing. You are paralyzed, you have no reflexes, and you have no response. So it's only after trauma. Then what happens is, slowly as you recover from your shock, your spinal shock, you will have this upper motor signs. Okay, this is spinal shock. Okay, so you will have loss of sensation, motor paralysis, areflexia, and then you recover with upper motor neuron signs. Do you understand? Because if there is any damage to the spinal cord or his brain, what are you supposed to have? Upper motor neuron lesion, right? But in this case, first upper motor neuron does not come because it's a shock. And that will lead to loss of sensation, motor paralysis. Basically, none of your tracts are working. Your cortical spinal tract, your spinal tract, nothing is working. That is why you will have loss of sensation, no movement of muscles, nothing. Okay? Now, it also has got autonomic effect, which is, if it's above T6, you will have overstimulation of if the spinal trauma was above T6, okay, you will have overstimulation of the autonomic system, which would be what? Hypertension, throbbing headaches, which would be morely pronounced as sympathetic system. Under the autonomic system, morely pronounced would be a sympathetic system, so you will have hypertension and throbbing headaches. But if it's a cervical spine, you will lose your whole sympathetic innervation. Sorry. So if it's above T6, you will have overstimulation. But if it's at the cervical level, you will have understimulation or loss of your sympathetic innervation. So you will have hypotension and bradyarrhythmias. This can lead you to death. Okay? Then S2 to S4 or S2 to S5, which is a sacral plexus, and that's that is responsible for regulation of your bowel and bladder. You will have incontinence. Okay? Now, the pain which I was talking about. The pain can be of various types. It can be at the root here, or it can be the segment, or it can be in the bone. Now, if there is a damage to your root, I am talking about the characteristic of the pain. Okay, on the opposite, what pain will you have? Or if it's at the root, you can imagine it is aggravated by movement because your root, your spinal nerve is supplying the muscle. So if you move with that muscle, your pain is going to increase. For example, if there was a tumor or something here, okay, the pain is connected. At the segmental level, it's not affected by movement. That is, which is within your spinal cord. Will it be affected by movement? No. Because the only thing affected by movement is your nerves. Okay. Then you have bone, that is the vertebral body or the processes there. And they also may not be aggravated by movement. This is just for your information. You don't have to know it. Then, now lateral compressive lesion. This is what I am talking about. Lateral compressive lesion is when there is a lesion on the lateral side of the spinal cord. Posterior compressive lesion means a lesion on the posterior part of the spinal cord. Now, lateral spinal lesion. What do you think would be the symptoms? First tell me, motor. What will be affected? How would be the motor deficit? If your lesion is here on the lateral side. Huh? I just explained it to you guys now. If it's motor, what on the same side? What on the same side? Lower motor neuron on the same side, but below that would be. What about pain and temperature? Opposite side is damaged. There is no loss of that. And what about your discrimination? Same side. Okay. This is what I was trying to tell again. Because you have like an overlap. There is an overlap. This sensory deficit is not so pronounced. Do you understand? Because you already have like two spinal thalamic tracts crossing over. This deficit is not so pronounced, but I have seen patients with these loss of pain and temperature. Right. Now, do you know Brown-Sequard syndrome? This is only at the level. What is a long tract damage? A long tract damage is where your whole tract gets damaged completely. Okay? That unilateral means only on one side of the spinal cord, is called Brown-Sequard syndrome. Okay? Unilateral long tract damage. Okay? Unilateral long tract. Long tract means the whole what?
Spinal.
The whole pathway is damaged.
Okay.
So, this unilateral. And complete cord syndrome means the whole spinal cord itself gets damaged. Okay? Unilateral means only one side gets compressed, but in whole cord, the whole spinal cord is damaged. Okay? Yeah. This is what I was talking about. This is your second nucleus of spinal thalamic tract. Comes here, goes here and then goes out. Now spinal thalamic tract is, you know, like in your motor cortex you have the homunculus with the leg and the hand and all that. Your pain and temperature is also divided like that. It will first apply, the division is cervical, thoracic, lumbar and then sacral. So, if there is any lesion, sacral is usually left alone because it's at the end of this fiber. Cervical gets damaged, thoracic, lumbar and then the sacral only gets damaged. You should remember this division. Okay? Fibers are divided into cervical, thoracic, lumbar and sacral. Okay? Now this is Brown-Sequard syndrome. That is your whole unilateral spinal thalamic, unilateral cord damage. Unilateral, only one side. So, you will have loss of pain and temperature on the opposite side. Okay? And then you have motor function. Vibration, position, defect is all dorsal column. Dorsal column supplies these functions. So, that is on the same side. And motor function is also on the same side. Okay? This complete cord lesion, where your whole cord gets damaged. So when your whole cord gets damaged, just imagine below the level you will have full paralysis and you will have areflexia because the corticospinal tract is not supplying the rest of the spinal cord. So that is why power and reflexes are absent or diminished below the lesion. Okay? Then loss of all sensory modalities up to the level because you have no more spinothalamic or no more dorsal column, so you will lose all the sensations below. Okay? You understand? Okay?
Yes.
You lose all your sensations below because this spinal cord is here. Okay? Imagine it's here. So for motor, anything below that, you will lose all your reflexes in upper motor neuron lesion, and then you will lose all your sensory modalities up to here. Above that, it's fine. Okay, it's complete cord lesion. That is when a lesion completely damages the whole of the spinal cord. In contrast to brown sacred, which is only the unilateral damage. Okay. Central cord lesion is from the middle. Okay. You have diseases, for example, syringomyelia, which is like it forms like a cyst within the central canal, and it keeps tearing and tearing and tearing. So what happens first? Your spinothalamic is damaged. Why? Because crossing over takes both the sides get damaged. Then your anterior horn cells damaged. Why? First of all, why is the spinothalamic damaged first? Because it's crossing over here. Later only, the stair will reach up till the anterior horn cell. So you will lose motor function as well. Okay? That's what it is. You understand? So in the case of central cord, your spinothalamic gets damaged first. Okay? But for example, if it's a lesion outside, for example, this tumor, your roots get damaged first. Isn't it? Then only it compresses and then damages the spinothalamic. But if it's within the spinal cord, your pain and temperature gets damaged first. Because there's a crossing over that's taking place. Understand?